Muhammad Afiq Basiron, and today my group will present a project proposal on subject robotic system code BEJ44203 about knee braces for torn anterior cruciate ligament patient, which also known as ACL patients. For our research background, we would like to explain first about anterior cruciate ligament, which is ACL. Anterior cruciate ligament runs from the femur to the tibia and is made up of thick connective tissue. Due to it resist anterior tibial translation and rotational stresses, the ACL is an important component in the knee joint. There are few causes of injuries, which include quick changes in direction of movement. Second is fast halting. The third is jumping and landing abnormally, and the last is direct slide to the lateral side of the knee while running. So we move to anti-ACL treatment, which include RICE therapy, which also known as rest, ice, compression of the affected knee, elevation of the affected lower extremities. And the last is the anterior cruciate ligament, which is ACL test. For the test, which include anterior drawer test, pivot shift test, and the Lachman test. For our project objective, we would like to describe the clinical features of anterior cruciate ligament injuries. Second is to manage the long-term rehabilitation of patients with anterior cruciate ligament injuries. And the last is to verify that the knee braces for torn anterior cruciate ligament patients are suitable to use for rehabilitation process. That's all from me. Thank you.
My name is Muhammad Akil Azri, and I will present for the methodology for proposal. So first, we find research article, then we install software and start project, and lastly do a test and analysis. For budget, item not MCU, quantity 1, price is 20, second is DC motor, quantity is 3, price is 60, next is fabric, quantity is 1, price is 100, and lastly is mold, quantity is 1, price is 500, and total is 800.
Assalamualaikum. My name is Muhammad Ani bin Amdan. For the expected result, non-braces produce adverse effect on the anterior cruciate ligament. Number 2 is no significant difference in the strain on the anterior cruciate ligament. Function braces are designed to facilitate normal kinematic of the tibiofemoral joint while limiting abnormal displacement and loading. Next, biomechanical investigation have demonstrated that the application of a functional knee brace to a knee that has a torn anterior cruciate ligament is effective in control of abnormal anterior translation of the tibia only at low anterior shear load condition and not during the high load. Next, increase the load on the anterior cruciate ligament when a brace was applied to knee, and describe this as a preloading of anterior cruciate ligament. That study suggests that bracing does not protect the anterior cruciate ligament when anterior shear load are applied across the tibiofemoral joint. And the last one is purpose of this study was to quantify the strain on the anterior cruciate ligament in the presence of normal muscular function when no loads were applied to a knee fitted with a functional knee brace, and then to determine if bracing altered. For the conclusion, This study provide a CAD modeling for simple knee braces prototype from low-cost materials such as neoprene, nylon, and aluminium to shield knee from stress and relative motion that would lead to speedy recovery and help in ameliorating the pain. The knee braces and sleeve reduce flexion and abduction movement but did not reduce the knee joint shear force, internal rotation moment or the ACL force. That's all. Thank you.